Good morning, everybody. Welcome to the Social Care and Living Well Challenge Domiciliary Care briefing event. You'll note that the event is being recorded today. That's so everybody can access the recording afterwards and see the slides at a later date. You'll notice that your mics and the cameras are off for all attendees. We've got a Q&A section set up. Hopefully you can all access that. If you have any issues in accessing that and you want to kind of drop us a question, please send it to our email address, which is sbri.coe@wales.nhs.uk. We're going to be taking Q&A questions throughout the event, but we'll be answering them at the end once we finish through all our presentations. So hopefully you can all see the slides up on the screen. So as I said, the event's going to be running from around 11 till 1 o'clock, but we may finish slightly before then. So I said cameras and microphones being disabled, Q&A session at the end, and please don't use the chat function. I don't think you can anyway. I think I've disabled that, so all should be well. So we're going to hear from a number of different presenters today, but before they join us, I'm just going to give you a brief overview of the SBRI Centre of Excellence, who we are and what it is that we do. Manager for the SBRI Centre of Excellence. The SBRI Centre of Excellence is funded by Welsh Government and hosted by Betsy Cadwallader Health Board. So we've been set up to provide challenge-led innovation support across the whole of Wales. So we work with private sector organisations to identify what their unmet needs are, and then support them to develop challenges, which we then launch to the market for innovative suppliers such as yourselves to develop new ideas, new solutions that can address those unmet needs. So we've recently grown as a team. So started off as quite a small team to begin with, but as we're approaching our 5th year, we've expanded. So we have a new deputy head of challenge-led innovation within the centre. We have new project support in terms of Anya Palmer, and I've joined the team as well to help provide some additional capacity. So primarily to date, the SBRI Centre of Excellence has been focused on health sector problems, but actually we're expanding beyond that now to help provide additional support for challenge-led delivery. So that's in the form of social care, which is what brings us to the challenge today. We're also looking at things like net zero, circular economy and other areas as well. But basically we're here to support people in SBRI delivery and to provide that challenge-led support, creating those conditions for innovation to address unmet needs across Wales. So just a brief little fly through of some of the current challenges that we've got in delivery at the moment. So the majority of these are either in phase 2 or they're starting to move into phase 2 at the moment. So we've got changing the way we deliver emergency care. That's with the Welsh Ambulance Service Trust. They should shortly be commencing their phase 2 delivery. The other 2 are safe and ethical disposal of nitrous oxide and NOx medical gases. And also, how do we improve access, excuse me, to information for relatives of patients whilst their loved ones are in hospital. So we also have a number of challenges that we've also delivered to date. They're all on our website, and there are a number of case studies and then the details of any challenges that we've delivered to date. So please feel free to visit that and learn a little bit more about what we've done to date and who we are as a centre. So it's a brief little run through for the agenda today. Our first presenter is going to be Tom Doyle. He's going to give you an overview of SBRI, what it is and how it supports innovation funding across the UK. We're then going to hear from colleagues within the Welsh Government Innovation Team, Greg Green and Steve Parks. They're going to be talking about the innovation strategy in Wales and also around more specific details about SBRI delivery in Wales. We're then going to hear from Denise Moultrie from Welsh Government and Stephanie Griffiths from Social Care Wales. And then you're going to jump back to me. I'm going to provide a little bit more detail on the specific challenge that we're sharing with you today before Josh Barnett runs through the Simply Do process and how you can actually submit your applications online. And then we'll finish off today with a Q&A session panel. As I said, pop your questions in the chat bar, in the Q&A bar. If you have any issues with accessing that, please do drop us an email. So I'm now going to move on to Tom Doyle, and he's going to kind of talk you through Innovate UK's position on SBRI delivery across the UK. Thank you, Tom.
Hi everyone, thanks for that intro, Kate. Yes, as Kate says, I work in Innovate UK as an SBRI account manager, mostly helping other public sector organisations across the UK use the funding mechanism. Next slide, please. So I'll just briefly talk you through what SBRI is and a bit of background really of the funding mechanism. So it is pre-commercial procurement that was developed by the European Commission sort of early 2000s. But SBRI is the UK's implementation of that mechanism. Now, unacronymed, it says Small Business Research Initiative there. That's very misleading, and that's something we're working on at the moment. But we do like to try and just call it SBRI where possible, because these competitions are open to all types and sizes of organisations, because it is a public sector-led procurement activity that is essentially to comply with the current procurement rules and regulations. It's not specific to SBRI. It does require a lead customer, and by that we mean that, when we look to run SBRIs, we're looking for some sort of reassurance that if a solution existed that met all the needs, there would be a public sector organisation that would want to implement it and purchase it. That's because we're spending public money on R&D. Running an SBRI doesn't commit organisations to purchasing solutions. It is a very outcome-driven mechanism. There are milestones which are paid on deliverables. So whereas grants are paid on effort, this is very focused on outcomes. Challenges need to be, defined to the extent where solution providers can develop solutions, but we do try as far as possible not to define what those solutions are. Occasionally, you might see an SBRI which is tied to a particular technology. That's just because sometimes budget comes along with priority technologies, but generally they are left wide and open to new innovations. And they are 100% funded contracts, unlike grants where match funding is required. Next slide, please. So a bit of background, Innovate UK have been custodians of SBRI since about 2008. And since that time, there's been over £1.5 billion spent across the UK through SBRI investments. Innovate UK provides support and delivery that ranges from just providing sort of guidance on a consultancy type basis to public sector organisations, and also delivering SBRIs for sort of end-to-end programmes. But on behalf of UK Gov, we look after SBRI and pre-commercial procurement in the UK. There was an independent report that was published last year. Sorry, I've got a bit of noise in the background. I hope that's not coming through too much. Just go into a little bit more detail about the mechanism and evaluation. You can find that, there's a link on there, but you can easily find it by Googling SBRI, giving public sector the edge as well. Next slide, please. So the mechanism was designed really to balance the sort of risks and benefits more evenly than a grant-based approach between funders and successful applicants. So it helps public sector organisations by solving their challenges, connecting them with innovative organisations that they may not otherwise get a chance to have contact and work with because of framework agreements, for example. Similarly, it gives those organisations a clear idea of what the public sector are looking for that don't already exist on the market, and connects them to that organisation. Many public sector organisations have taken part so far, and we expect more will do. And that's certainly one of our objectives. You'll see in that independent report, if you have a look, there are a number of benefits highlighted there, but one of them is sort of an average annual sales growth would be 30%, although obviously we can't guarantee that, but there are many benefits that successful organisations have obtained. Next slide, please. So just to split out, I suppose, a few more of the key features of SBRI, particularly in contrast to a grant-based approach, which you may be a bit more familiar with. They are 100% funded contracts for R&D services, no match funding, as mentioned earlier. I've already said about where the mechanism came from, and the payments for milestones. Payment is on achievement of bespoke milestones for each project, rather than just on a effort or upfront time-based sort of marker as with grants. Contracts are with one lead applicant organisation. They may subcontract, where that's justifiable, but that lead organisation does remain accountable. IP rests with the supplier, both background and foreground IP, but there are in the contract some free usage rights for foreground IP for the public sector funder, as they've covered all the costs for the developing that IP. Essentially, that means that if a solution became available, then you are only able to charge a fair and reasonable rate for that foreground IP. That's to prevent sort of a monopoly situation and successful organisations charging the public sector heaven and earth, as they're the only one. And also, if an organisation went into administration, then the public sector has access to that IP and they may go and use it elsewhere if they choose, but there are time-bound clauses around doing that. Those IP clauses are, they haven't come into effect very often, but all the detail is in the draft contract. As I say, they're open to eligible organisations. All organisations are eligible, sorry. So small business research initiative is a bit misleading. So don't worry if you're not a small business and listening. Absolutely encourage organisations not engaged in the sector already. That includes, research organisations such as public sector research establishments or academic organisations. But all organisations must demonstrate a route to market for the solution. Next slide, please. Yeah, I'll just finish off by sort of talking through. This is a textbook example, I suppose, of what pre-commercial procurement looks like. You have the sort of early stage curiosity-driven research, which wouldn't be covered by SBRI. That's sort of TRL 1 or 1 essentially. Then SBRIs can be applied anywhere from that up to very late stage, sort of TRL 9. Generally, they're done in a phased approach, where at earlier technology readiness levels, or when we're sort of at a feasibility stage, generally.
I think we might have lost Tom slightly. Hopefully he'll be coming back soon. I'll give him a couple of minutes. If not, we'll move to Greg's part and
Hello?
Steve's part. Hello, can you hear us again?
Sorry, I don't know what's going on.
No worries, we lost you for a moment. Thanks, Tom.
No worries. So yeah, as we go up to more demonstrator level projects, there are a smaller number of suppliers funded with bigger scale projects. The one thing that's worth noticing on this slide at the moment is the sort of grey bar between pre-commercial procurement and public procurement of innovation. That sort of denotes that a competitive procurement procedure would be needed if a solution became available and public sector wanted to purchase these solutions at the current time. So that's worth noting as well. I think I'll finish off there, especially bearing in mind my internet at the moment. Hope that was useful.
Brilliant. Thanks, Tom. We're now going to move on to colleagues from Welsh Government Innovation Team, Greg Green and Steve Parks. Thank you both.
Thanks, Kate, and thanks, Tom. What I'd like to do in this session is really just give you a bit of a context to why innovation is important to Welsh Government, and an update on the new innovation strategy, which has just been launched earlier this year. I'll be presenting today with my colleague, Steve. So I'm sure you've all picked up a copy or downloaded a copy, published in February 23. Wales Innovates. It's our new or updated innovation strategy. And it's looking at what innovation is, and in the simplest terms, it's about developing new ideas into products and services. It can mean inventing new things, or it can making older things work better. And what we're talking about today is very much not in the it's in the space of service improvement, service delivery. So there's innovation has not always been obvious in that area. It's been very much incremental, but the opportunity for a step change is on the table today. And innovation aims is make things better for people, including everyone, is be flexible and have people work together in collaborative style. Next slide, please. So just again, going back to where Welsh Government is at, again, some of you may be aware of the well-being goals of the Future Generations Act of Welsh Government. And along the top there, you've got a key areas that all the activities and policy objectives of Welsh Government do must fall into these areas as prosperous, resilient, healthier, more equal, cohesive communities, vibrant culture and thriving Welsh language, and globally responsible. So on the next line down, how we do that is understanding Wales, is look at where we're at, look at the national indicators, how we compare, how we benchmark, analysing data that is available to us from all our different sources, monitor our progress through achievable milestones, but have one eye on the future, looking forward to make sure we're going to be picking up opportunities from future trends, and how we measure the impacts of innovation by interventions, programs, the instruments that we use to drive innovation across innovation stakeholders and innovation active businesses and academics. So making it happen. So one of the interesting things about the policy refresh is embedding innovation across all Welsh Government functions, whereas previously innovation was siloed within the economy and businesses do innovation, but it's actually trying to look at areas such as health and such as the environment, is how can innovation be applied and have positive impact in those areas as well. So we do that through external collaboration, so the public sector, private sector, third sector, academia and communities. And as Kate mentioned in her intro, the health boards are very active and very supportive, working collaboratively with us in these challenge-led areas. So we just want to unpack that further and get more and more public sector bodies engaged. Next line down is making it happen, delivery. So sorry, innovation culture. We have some support mechanisms that we can assist innovators within the Welsh business community. We're looking at capacity and capability building, how we communicate the opportunities. We work very closely with Innovate UK. They have a whole slew of opportunities, calls, competitions, and we're trying to make sure Welsh businesses understand and are able to apply with good quality applications. Effective collaboration, we can bring people together to have a multiplier effect. And again, as mentioned before, it is how we benchmark, how we measure impact. And a lot of that, especially from my side of my role, is how much money can we secure from the likes of Innovate UK for Welsh businesses. So 5 ways of working: sustainable development principles, collaboration, integration, involvement, taking the longer term view and doing things which prevent negative future trends as well. And enabling change, as I mentioned earlier, the Wellbeing of Future Generations Act, the programme for government, which is obviously running for this period of the Senedd, and the actions and commitments made within the innovation strategy. Next slide, please. So this little pizza pie, if you start from the centre, we're really focused on citizen communities, and obviously the care sector is also right and centre of that area as well. And if you look towards the 7 o'clock to 9 o'clock, it's health and well-being, and just beneath that then is better care provision. So this area of innovation is one of the core areas of our whole innovation missions within Welsh Government as well. Next slide, please. So our priorities: digital transformation, net zero, agri-tech, food and rural economies, creative industries and media, and once again, population health and biotech and materials and manufacturing. So again, it's very, the care, health, well-being sector is very much an innovation priority for Welsh Government. Next slide, please. So the launch of the policy, some of the early actions, we've got an MOU signed between Welsh Government and the Innovate UK, and we were just in the process of publishing a joint action plan, which is all about connecting support, stimulating innovation and data for a fairer and more prosperous Wales. And we've also launched earlier this year our flexible innovation support offering as well. So if you just click next slide, there should be some visuals. So that's the Minister and the Chief Executive of Innovate UK. That's the launch of the Smart Fizz Flexible Innovation Support Programme. And we're also working with the Circular Economy innovation activities there as well. So I'd like to hand over to my colleague Steve, who will pick up the innovative procurement strand of what we're doing under the policy.
Great, thanks very much for that, Greg. So start by looking at the procurement reform bill. So what that looks to do is embed three key principles. Firstly, to create a simpler and more flexible commercial system that better meets our needs, but whilst still remaining compliant. Looks to open up public procurement to new entrants, such as small businesses and social enterprises, so they can compete for and win more public contracts, and ensure that there's transparency throughout the life cycle, so that the spending of taxpayers' money can be scrutinised properly. SBRI plays a key role in supporting the procurement of innovation by enabling the public sector to engage with industry during the early stages of development. Starting with defining the challenges that are faced, without getting too much into the specifics of solutions initially, as Tom covered expertly previously. This enables businesses to research new opportunities through funded R&D contracts, and new ideas can be explored then through a phased approach that minimises the risk and helps identify the most promising projects and solutions to take forward. If you could pop the next slide up, please, Kate. Thanks. So this is where we show off a little bit. The SBRI approach has worked for us in Wales, and we've shared what we do with different administrations internationally, so we can justifiably claim ourselves to be a world leader in the field. We've advised the UK governments on their GovTech Catalyst programme, which makes use of the SBRI approach. Our Cardiff Capital region have used the model and are currently running a challenge to develop innovative solutions which can significantly improve sustainable production and supply of food. And we've invested in establishing the SBRI Centre of Excellence itself, hosted by the Betsy Cadwaladr University Health Board. The approach has been recognised for its work on the rapid sanitising of ambulances and the childhood obesity nutritious food challenges. So our belief in SBRI as a mechanism is founded on what we've seen rather than blind faith. If you could pop the next slide up, you're ahead of the game there, Kate. Just have a quick look at one or two, or more accurately, three examples of the type of challenge that we have supported, just to give you a feel for them. Better lives closer to home. The COVID outbreak significantly affected our community, society, and individuals. Alongside the increased pressure on medical and social services, there are effects on our physical and mental health and the economy through the loss of jobs and income, impacting on our living standards and the well-being of our communities. So to aid the recovery, the Welsh Government and the SBRI Centre of Excellence set out to identify and support projects that help communities, businesses and the public sector adapt to the ongoing threats and challenges. We supported a number of projects that looked at ways of supporting mental well-being, learning and independence for our young people, digital solutions that assist our local business communities, and supporting community groups as they look to maximise the impact of their carbon saving activities. If we move on to the next one, thanks very much, Kate. We supported Monmouthshire County Council, the challenge for tech businesses to come up with digital solutions to dealing with some of the issues around rural isolation. The council identified three areas of focus: using technology to improve interaction with older people whilst alleviating digital exclusion, coordinating our transport more efficiently, and better connecting people in rural areas to improve well-being and in turn reduce pressure on our health and social care system. There's one more, Kate. Thanks very much. We worked on a challenge with the North Wales Brain Injury Service that looked at addressing barriers to independence, specifically around cooking tasks. It's an interesting area to focus on. It was something I was thinking about last night, actually, if I digress slightly. My son, who suffers from cerebral palsy, has got a cookery lesson today. It's probably on as we speak. So I did a little dry run with him last night. We made a cheesecake, and a 13-year-old boy with cerebral palsy and a useless bloke trying to make a cheesecake. needs quite a bit of instruction. There's a lot of things that can go wrong. So utilising technology to support independence in that area was something that we looked at. And as Greg covered at the beginning, innovate. What we're about really within Welsh Government is using innovation to make the lives of people in Wales better. And I can't think of a better way to end it than that, to be honest. So that's all from me. Thanks very much.
Brilliant. Thank you both. Denise is going to talk next. She's going to speak directly to you. So I'm going to take the slides off the screen for just a moment. And then Denise is going to talk a little bit more about the Welsh context, the Welsh Government context in relation to this challenge. Thank you all.
Hi everyone. Apologies for the lack of PowerPoint presentations. Maybe it's a break for some of you. So I'm Denise Moultrie. I'm head of Welsh Government policy with regards to domiciliary care, also unpaid carers, but I'm talking about domiciliary care today. So we are really pleased that there is this £1 million that's gone into this funding this scheme. So I just wanted to say a little bit about kind of where the challenges that I'm sure you're all aware of really with respect to domiciliary care and with Welsh Government policy specifically around domiciliary care. And so with an idea of what kinds of bids we would particularly welcome, I think, albeit that you've got a kind of wider criteria set out. So I think the challenges in domiciliary care have been fairly ongoing for many years, exacerbated by the pandemic, exacerbated by Brexit to some extent, and certainly exacerbated by the current cost of living crisis. So there have been some major challenges. We've got particular problems with the workforce, so we haven't got enough people working in social care. There's many reasons for that. I mean, and there's huge amounts of work that have gone in the last couple of years to bring in the real living wage, for example, and for Welsh ministers to agree to fund that for a second year. We know that's not enough in and of itself, and as I say, the cost of living crisis has kind of caught up with that. So there are undoubtedly challenges in terms of pay in the sector. There's also challenges around conditions in the sector, so that we know that vast majority of domiciliary care operates within the independent sector, where things like sick pay and pension are far less likely to be available than workers that are in the public sector. So all of those things together, people are working on in shift patterns where they're not paid for downtime. Usually, that's not always the case, but so people's working hours are, can often be quite disjointed with parts in the day where they might want to be able to earn, but actually can't, because that's not where the demand is for domiciliary care. Lots of 0-hour contracts. We're doing a current piece of evaluation of 0-hour contracts at the moment and the use in the sector, and there is quite mixed views, but generally we've been trying to move away from such a reliance on use of 0-hour contracts. So there are the workforce challenges. The other ones are about the actual models of commissioning, where unfortunately we know that there has been there's a lot of pressure from local authorities who don't have lots of money to spend to have commissioning arrangements with providers that really are really pushing down or keeping down commissioning rates, and that then obviously has an immediate impact on the workforce and services that can be delivered. There's a lot of there's been lots of attempts to move towards more outcome focused as opposed to more time and task, more traditional methods of both of commissioning and of service delivery, and in fact that has been brought in areas of Wales, but by no means widespread, and there are some real and obvious challenges to bringing that in within the conditions that I've just described. If you haven't got enough staff, it's actually quite hard to bring about any other model of delivery. So outcome focused is still an aspiration in most areas of Wales. So In terms of a strategy, you'll know that there are documents like A Healthier Wales, and there's lots of other national programmes at the moment that are designed to bring together more integrated working of health and social care in the community. So more primary care in the community, working more directly with social care. One of the things that we're really keen to do within that is to bring domiciliary care, and including private or third sector independent domiciliary care providers, into that community place-based model of working with the family. So I think, you know, we want domiciliary care workers to be increasingly valued and respected as the professionals that they are, and to be part of the early warning systems around. They're often the people that can see, because they visit Mrs. Jones 3 times a day, that actually she's getting a bit wobbly on her feet and she might have a fall. We want to do far more in the early intervention and prevention space, so that people don't end up in hospital and don't end up then having to recover from being in hospital, and all the impact that we know that has that, particularly on the older population. So very much want to invest and look at models that are more likely to bring domiciliary care into that kind of multi-professional working around the person in the community, and perhaps that might mean that they might need to have time in the day to do it. And obviously, if you're whizzing from one visit to another, then that's kind of your ability to be involved in that way is restricted, which is how it's been to date. So very interested in stuff that brings relevant professionals together in the community and aligns with all these national programmes. So there's I'm probably not going to do the names justice. There's the Enhanced Community Care Programme. We know there's the 6 goals for urgent and emergency care, which is obviously concentrates a lot on discharge, which is another area of great interest. And there's another model, particularly around primary care and integration in the community. So all of those things, I think, are of particular value and would align with policy. I think one of the things that's always the challenge with funding streams is that we don't kind of, and to a certain extent, we've been guarded against this because, you know, as has been described already, although this is a lot of money in terms of up to £1 million, we're looking at a smaller number of quite large projects rather than lots and lots of little projects. And I think that's the real challenge, isn't it? You know, I was speaking to a head of service, one of the local authorities last week, and, you know, they had 3 different pilots in place all around domiciliary care already. And I kind of think, well, if that's replicated off Wales, that's a lot of little pilots, all potentially testing very similar things in very small areas. And I think what we increasingly want to do is perhaps move away from that, have smaller number of much larger projects, which this is kind of, you know, in line with that, and really testing out areas that have already been tested before, to start in a smaller scale, and that's part of the criteria, but aligns with some of those things that I've just mentioned, really. That means, because we can learn much faster from them, because we already have national programmes set up in those areas. So if we can point to something that's happening in an area of Wales in line with where we're trying to get to, we can all learn from that in a much more quicker and cohesive way than lots of little projects doing kind of really quite different things, and they're quite harder to grow. So I'm wondering if that might be, yeah, I mean, there's always the risk of duplication of effort. So and that's one of the challenges that we work across 22 local authorities. So I'm very much hoping that this programme, this particular funding programme, helps us to move to some smaller number of bigger projects that aligns with some of those themes that I've mentioned already, and that people will be familiar with. They're not new, and that can very much be part of the work that we're doing to move ahead on that, which is ultimately there, you know, about trying to develop things like national specifications for domiciliary care, which doesn't mean to say it'll be a one size fits all. We know, you know, but again, just moving towards, if we could have a blueprint for domiciliary care services, what components, what tested, evaluated, but new and, you know, improved components would that have, in terms, either in terms of delivery or in terms of how we get more of a sustainable workforce in place to deliver it. I think that's all I was going to say, Kate.
Lovely, that's been excellent, and thank you so much for all that valuable context you provided. I'm now going to pop my slides back up on the screen very quickly, and we're going to move across to, hopefully you can all see that again. We're going to move across to Stephanie Griffith from Social Care Wales.
Hello, good morning everybody. I'm Steph from Social Care Wales, and I'm just got a few brief slides to talk about who we are, what we're doing, and I suppose how we got involved in some of this as well. So the next slide, for people that don't know, and I think there are some people on the call that will know who we are and what we do, but just in case people don't, I'm not going to dwell on this and spend a long time on it. But Social Care Wales has kind of a widening remit around supporting social care in Wales. We've always had a kind of a remit around developing the workforce. We do a lot of workforce development, working in partnership often with HEIW and others, and setting standards. We are also the workforce regulator for social care and social work in Wales. And have more recently, I say more recently, but it's actually a fair while now, had improvement research and data responsibilities. The most recent thing we've started to do is work in innovation. So we've been setting up some services to support innovation in social care over the last year or so, just over the last year. And to inform what we did around that, we did some user research. What we're doing is referenced in the innovation strategy that was spoken about earlier in that health and wellbeing challenge. But we did some user research with, not with everybody in social care in Wales, but with a selection of people across different roles, from practice to policymakers and leaders and all sorts of different people in between with different roles, to help us think through what might support innovation more broadly in social care. So the next slide gives us some of the information that showed us. If we can move on, that's the one. So we had key messages around what we could do, but one of the things that came through really clearly was how innovation in social care can look and feel a little bit different to how it does in some of the other sectors, like, for example, health, but also education, and a sense that people didn't feel that they were overly well supported for innovation. The 3 points that are up there are the 3 things that came through where somebody like Social Care Wales could help. And being a regulator, in a way, helped and didn't help. People didn't necessarily think we would do innovation support, but actually they also felt that we were a kind of known, trusted national organisation that could probably reach a lot of people across Wales and help to join things up. Because I think what Denise was talking about there is really true when you think about all the different local authorities commissioning things in different ways, but then all the providers, because a lot of social care is provided by the independent and third sector as well. There's an awful lot of people involved in social care in Wales. So that first role we have is around convening and bringing people together, both in terms of helping people working in social care speak to people making the decisions, but also in terms of sharing practice, learning and reflecting together and thinking about how to meet some of the challenges. The other roles they found for us was around exploring how to embed innovation in things like practice, so learning development contracts, and then a platform. People wanted a place where they could share and learn about other people's sort of innovations and innovative practice. But one of those things, coming back to that support for innovation that we've found, is that there are things out there like the SBRI challenges and ways of working, and they're really useful, especially talking to this one, which can be quite flexible in its breadth, and really quite sort of welcoming when we spoke to people, and with an appetite to work with people who are working in social care on their challenges. But it can feel like quite an unfamiliar thing for people in working in social care to do, is to think about the challenges and think about the solutions and work on it in this way. So we have kind of an area of work, if you like, where we're trying to think about who is supporting innovation across health and social care, and how can we support people in social care to access that, and people providing that support to make it accessible, I suppose, to people working in social care. So we're really, really pleased to be a part of this and to see that the SBRI challenge has kind of gone way beyond that and actually targeted one of the key challenging areas in social care for this challenge. So just to talk then briefly on the next slide, if you can, about the other support offers we have, because we're doing lots of partnership work, but we're also doing things like developing a strategy for, I know we've got the cross-government innovation strategy. We might not end up calling what we're doing a strategy, but this covers research, innovation and improvement in social care. And that's something we're going to be going out to consultation on in about 2 weeks. We're developing evidence summaries because we know people don't have the time and confidence to go and look for, primary evidence. We're developing communities of practice and communities of action around some of the challenges. We have just gone live with a coaching support service it started on Monday, so that's open for queries. I'm happy to talk more about any of these if anybody wants to. We're developing evaluation support because that's something else we know people struggle with, and that's linked quite closely to skills and capability around innovation as well. I'm going to skip that one, but we are sharing practice examples through a website. But the one in particular that I'm going to talk about in the next slide as well, if we can move on, is support around digital innovation. And it felt quite nice to share this here because I think this challenge is, people have talked a lot about the technology and digital in some of the challenges that have already gone through the SBRI process. But what we did some work looking at what's available across the UK. Where could we take inspiration to support digital innovation in social care, and what are the issues for people that really need addressing? And what came through really, really strongly for us was that those basics around digital inclusion and skills are really important, that if you don't begin to address some of those, then the people who are able to use digital means will fly perhaps and leave everyone even further behind. So it's also come through in our consultation on the workforce strategy. So we know we've got some work to do around that, and we know that involves a lot of partners like Digital Communities Wales, for example, and Digital Health and Care Wales. So we know we've got some work to do there. But then the second one really goes back to what Denise was saying around identifying common challenges. So, this is something we're really early on in this work. We're just planning it. So how do we identify those common challenges across what's quite a disparate system of services and support so that we can get sort of the best value, both for the people investing in developing innovations, digital innovations, and for those, we get the common challenges for social care. So we're going to be looking at how we could support some of that as well. And then this final point around promoting co-design is very much based around how, however good and effective it might appear to be, if the people who are going to be using the whatever it is that whatever the digital technology that's developed aren't part of that, they might not use it. That's the workforce, that's people accessing care and support. So that's another thing we've got to think through. How do we promote that co-design? And I think that's a really important thing we've spoken to Kate about, and that's included as one of the criteria in this challenge. So yes, the final slide I think from me is about the this challenge. So yeah, we are working, as I said earlier, with SBRI to think about how could we engage with social care, but obviously having a challenge directed at social care is really a wonderful thing to be able to have. And we know that it's an organisation with those established networks in health, and it would be really nice to be able to establish a network or some kind of ongoing communication with social care as well, so that actually social care can get the benefit of all this support that's there, and address some of those common challenges where we can, but local challenges as well. So in our role, we're really happy to be here, really happy to be a part of it, and to try and raise the profile of SBRI in social care as much as we can. And that's it from me. Thank you.
Brilliant. Thanks so much, both. That's been wonderful. So yeah, back to me again, I'm afraid. So I'm just going to run through a little bit of an overview of the challenge specifics, just to give you a bit more details if you haven't already seen them on the Simply Do platform. I'll also run through some key information in terms of the amount of funding available, but also the key dates as well, just so you've got those all very clear in your diaries. So what is the challenge about? So basically, we are seeking to identify and support delivery of collaborative projects that can demonstrate the potential and scalability of near-to-market solutions and/or previously researched models of care, enabling development of core evidence and case studies to inform future business cases and wider rollout. And I suppose the key thing to note about that is that very much this challenge is about being collaborative. But also it's not about looking at early feasibility. This is how we build upon what has been explored before, what strengths have been identified, the ways in which people have already started to work together, and provide that avenue to build upon that and kind of really start to demonstrate what those benefits might be and really kind of capture that evidence as we go through these challenges. So as I've said, very specifically, this challenge is not looking at supporting feasibility studies. We're looking more, if you remember the diagram that Tom showed earlier, we're looking more in that phase 2 and phase 3 area. So what we're looking to support in terms of the contracts that will be funded will be phase 2, so prototyping and demonstrating, really get into that on the ground testing of your ideas and your solutions. And then the other element that you can potentially position your project as is as a phase 3. So where you've already done that prototyping, demonstrating on the ground, perhaps on a smaller scale, but now you're looking to see what impacts can that potentially have on a much broader demographic, for example, in areas you might not have tested your solutions as yet, and how can you use this as an opportunity to scale and spread and further build that evidence case for the benefits that you think your solutions and ideas can deliver. So the areas that we're potentially looking at, the core theme for this is around, as I said, domiciliary care. So that's new models of services, but also it's around that complementary solutions and technology, as Stephanie's just touched upon, you know, that digital element. What can we kind of learn from in terms of these emerging technologies and how they can help us in increasing that sustainability of care? But core point, as Stephanie said, about not leaving people behind. So we've got to make sure that within whatever solutions we're developing, we've got that equality of access. So these new models of care, they must be co-designed and co-developed with the public and users of care alongside frontline health and social care professionals. And as Greg touched upon in terms of the innovation strategy, this all comes back to the well-being of future generations and very much in terms of the ways of working, you know, that involving people in the design of these solutions so that actually you're developing things that will very much meet their needs, which again comes around to the Social Service and Wellbeing Act and around, you know, person focused and enabling them to live hopefully the best lives that they can. And then underpinning that as a kind of side, is a connected theme, I should say, is the supporting the foundation. So potentially looking at some of the barriers that there may be that can prevent us from either delivering services or you know, enabling us to use these new technologies. So that's around skills growth, connectivity and recruitment and retention. So this also includes things like digital literacy, accessibility and affordability of complementary technology, which again touches on not driving greater inequalities through solutions we develop, and things around poor signal and rural not spots. So it's about how we kind of have that accessibility to all, and then things around recruitment as well. Obviously noting these are huge challenges and there's only so much what we can do within a 12-month period, which is what these projects will hopefully be delivered against. But it's kind of what can you start to do now to develop some of that evidence of those potential benefits and evaluating those solutions through the delivery of these projects. So Denise has already touched upon in terms of what the budget is. So its current availability is up to £1 million, and that's hopefully going to support around about 5 projects. So that would be what we're looking for is we'll probably take a portfolio approach to selecting those projects. So what we're looking for is projects that can demonstrate delivery and impact across Wales. So we're looking kind of for a good spread of projects, hopefully across the whole of Wales. So the outline budget for phase 2 or phase 3 project is up to £200,000. So, but we do reserve the right to adjust the budget availability. Say, for example, if we can bring other funders on board to increase that, but also considering if, say, for example, a project is submitted that potentially could deliver across the whole of Wales, we might reserve the right to consider a larger kind of funding amount for that if the scale and quality of that submission does allow it. But as a rule of thumb, we're looking up to 200,000. So within that funding availability, project costs can be claimed. So for obviously we'll have a lead applicant, but what we're looking for people to do as part of this, and as I said, a very much a collaborative approach, is to work with the potential end users, whether or not that's a service provider, whether or not that's local authorities, health or third sector collaborators, but also in terms of who's actually going to use that solution at the end. So project costs can be claimed for the innovative solution provider, but also for the staffing resource requirements of the future end customer. So say you're working with a local authority, those costs can be claimed as part of that application, and those costs should be included as a subcontract cost within your application. So when we're looking at the budget, we should be seeing a breakdown in terms of, the different roles that are going to be kind of delivered as part of this project and how that funding is split across those. So what are the key aspects that we're looking for in terms of this challenge? So I've said it before, but I'll also say it again because it's super important. These projects must be collaborative in nature. So we must be working with future Welsh end users and end customers throughout the project delivery. So we're going to really be looking within that application form for you to kind of set out how you're going to do that, what your plans are to include people. So we're really looking at that kind of co-design, co-developed and co-delivered. So we've got to involve people right from the start in order to kind of deliver solutions that are better able to meet their needs. So current climate in terms of budget, we all know how difficult it is and we can't get away from that fact. So sustainability and affordability will be key. And as part of this project delivery, what we're hoping to get to at the end is a full evaluation, which will include a benefits analysis and an economic analysis in terms of what you've learned through the delivery of your phase 2 or phase 3 project. So again, touching upon that equality of access and meeting as many needs as possible, solutions must demonstrate that they've got an inclusive approach and that they consider any additional needs or barriers that might be in place that might prevent the end users from accessing a technology or service. So we don't want to be supporting solutions that further kind of have that disparity in terms of access to service, whether or not that's in terms of the affordability or whether or not it's in terms of the skills needed to access those solutions. So one of the other things you might note when you look through the brief in more detail on the Simply Do platform is that we're hoping that these projects will also look at a skills builder element. So how are you embedding and enabling the skills that people need to actually work with your solution and use it in a way that's really going to help benefit them in the long term, whether or not that's as a service provider or a potential service user. It's how will you, throughout the delivery of your project, work with them, but also provide them with the skills that they need to use these solutions or services really effectively so that we're getting the benefits that we're setting out in our projects. So key reminder in terms of the dates. So there is a hard deadline on challenge submissions. So that is 12 p.m. on the 20th of October. Please don't, I know we're all like it, we all tend to leave things to the last minute and then submit it 5 minutes to 12 p.m. Please, if you can avoid that, don't do that. If there are any problems in your submission, if it does go past the 12 p.m. deadline, we can't help you with that. So if you kind of test it earlier, make sure that you can submit your applications. If there are any problems, we can do our best to help you. But as I said, if it's past that 12 p.m. deadline, I'm afraid there isn't very much that we can do on that front. So please try not to leave it till the last minute. Josh is going to go through in a minute about a bit more detail and walk you through the platform. But hopefully you'll be able to kind of see that you can dip in and out of your application. So once you start it, you can come back and finish it and add to it, encouraging your potential subcontractors and collaborators to feed in information as well. But as I said, please submit by 12 p.m. on the 20th of October. So we've also set out some key, I suppose they're more target dates at this point in terms of when we're going to assess and hopefully award those contracts. So please note, these may be subject to change, but these are the deadlines that we're running to at the moment. So once the applications close on the 20th of October, the application scoring will take place on the week commencing the 23rd of October, with the hope that we'll shortlist the applicants, so the kind of highest scoring potential projects by the 27th of October. At that point, we'll notify the people who've been successful in being shortlisted, with the aim to hold a meet and greet on the 6th of November. So meet and greet, basically what that is, it'll be an opportunity to present online, say a 5-minute kind of quick presentation of this is a summary of what my idea, my solution is, and enabling the decision makers to ask some key questions to draw out some additional information that will help them with their decision on who will be funded. After that, the aim is that the decision will be released on the 8th of November, and then the hope is that the contracts will be awarded on the 10th. Sometimes takes a little bit more time, so there may be some leeway on that. And our hope is that the projects will commence on the 20th of November. As I said, looking at up to 12 months for delivery. Once those projects are complete, aiming for the 29th of November, we'll then be looking for those applicants to then submit a final report submission by the 11th of December 2024. So again, as I pointed out earlier, as part of that final report, it's going to be really key that we've got that benefits analysis and that economics analysis, because that's kind of where we're going to set out the future sustainability of the service or solution that you've developed. So I'm going to stop sharing for a minute, because I'm now going to hand over to Josh from Simply Do platform, and he's just going to give you a quick walkthrough in terms of the Simply Do website, what it looks like, how you access information. There's some key things around the marketplace, which is a little bit different to the norm from what we've done. So hopefully we'll be able to kind of clarify a little bit of that whilst we're at it. Thank you, Josh.
Super. Thanks, Kate. I'll just share my screen. Okay, so I'm just going to spend the next kind of 5 minutes just walking you through the Simply Do platform. Kate just touched on a couple of things. Now, typically, what would happen here is there would be one challenge, and you would apply for the funding by creating and submitting an idea for that challenge. Now, in this case, due to the nature of the challenge and the requirement of collaboration, we've essentially set up 2 separate challenges on the Simply Do platform. So I'm just sharing my screen now. So when you're given the access link, or when you access the Simply Do platform, typically you will arrive at this page. Now, as you can see on the left-hand side, we have the social care challenge. That is the official challenge fund. That is where you will go to submit your application prior to the deadline. If you're looking to find a collaborator for that challenge in order to go forward for this final submission, you just need to go over to the collaborator marketplace. This challenge in particular has been set up to enable you to submit what you're offering and what you're looking to find collaborators for within this submission. So this is your public marketplace to find end customers, future collaborators, solution providers. So within this particular challenge, you've got a lot of the same information. I'm not going to go through it here because I'll go through it on the main challenge page. You can see when certain things happen. So as you can see, the challenge collaboration. So this part will end a week before the challenge closes. So you've got a little bit of time here if you want to go out and find collaborators to go into this challenge and create an idea. You can then submit that idea and also view the ideas of other people who are also looking for collaborators. So I won't go into detail on that, but that is the collaborator marketplace. Once you're in a position where you have the lead applicant and you have your collaborator and you're ready to go and submit for the Domiciliary care challenge, all that you need to do is click this left-hand challenge here. Again, all of the information that's been discussed today and some supporting documentation can be found on this challenge page. Everything to do with the challenge, the funding, the timeline, everything will be found on here. A couple of questions that usually come up is this session is being recorded. So that recording will be placed onto this challenge so that you can access it afterwards. But all that you need to do is review the challenge information, so you can see what's in scope, what it is we're looking for, what's out of scope, funding allocation details, everything that's been talked about today, and also a link to this briefing event. That will change, and instead that'll be a video recording of this briefing event. And then at the bottom, you've got various links and documentation that you might want to review in relation to SBRI contracts and this challenge itself. Finally, in order to begin your submission, all that you need to do is click create your idea, create an account. Once you've created your account, you'll be taken through to an application form. Now, this is the application form that you'll need to complete prior to the deadline. And all that you need to do is work your way down from top to bottom, completing every section of the application form. The sections are down the left-hand side. As was mentioned earlier, you don't need to do this in one sweep. The platform will save for you. You can leave and come back at a later time and complete your submission in your own time. If you're working collaboratively with people on this submission, on the left-hand side of the screen, you can see add a collaborator. All that I need to then do is put the email address of the person who I want to collaborate on this submission with. They'll receive an email and we can both then work on this submission form together. All that's required then is to complete the sections right the way from application through to declaration. But the key assessment sections are from D to H. So around your solution, around the ease, the readiness and project plan, around how you aim to test this product, the finance section, and finally the commercialization. Now, what you'll notice is each section has a relevant question and supporting guidance to support you as to what you should be putting into that particular question. Finally, once you've finished your submission and prior to the deadline, all that's left to do is click submit. That will then come through to the team ready for assessment when the challenge closes. If you've got any issues with the product, you can't seem to add a collaborator, can't find the right challenge, all that you need to do is come down to the bottom right-hand corner of the screen here and open up a conversation with myself or another colleague from the Simply Do team, and we can support you there and then. But other than that, super simple. When you get the access link, you'll have two challenges. One's for the marketplace, one's for the final submission. Go to that final submission and create your idea. Work collaboratively, take your time, and you don't need to save as you go. The platform will save. Complete every section of the submission form and click submit. That's all that's required from the Simply Do platform, and I'll hand back over to Kate.
Sorry, lost my mouse for a minute. That's the joys of dual screens. Thank you so much for that, Josh. That's been super helpful. So yeah, as a reminder, 20th of October, 12 p.m. is the hard deadline for that submissions. And as Josh highlighted, if you put your idea on the marketplace, that's not the application part. Please make sure you do visit the application portal side and submit before that deadline. We have staggered the dates in terms of when that marketplace will close. So that closes just a little bit before the application window closes, just hopefully that people will kind of, again, to reiterate that that's not the place to submit your applications. It's the place for you to kind of connect, create your collaborations and network with other individuals. So another thing to note on the Simply Do platform, and I think Tom touched upon it earlier, with an SBRI delivery, there is a standard example contract that is used across the whole of the UK to support SBRI challenge delivery. So that's included in the additional documents at the bottom of the Simply Do page that you'll see. So please make sure before you submit your application that you make yourself familiar with that contract, that you're familiar with the terms, and that you're happy to sign the contract, because changes will not be made after your project has been successful. So please make sure that you're comfortable with those terms. So now I think that's the end of the presentation. My many thanks to all the presenters that we've had today and the valuable information that they've shared. So that now opens this up to question and answers. So if you do have any questions, please feel free to pop them in the Q&A section. I can see we've got a couple to be going on with, so I'll jump straight in if that's okay. So the first question that we've got In terms of care delivery partners, are you looking for a spread of different local authorities in Wales? Ideally, yes. Ideally, we would like a spread of different local authorities. Basically, I suppose the reasoning for that is, again, touching upon Denise's terms what she shared earlier in terms of not supporting small scale things. We're looking at kind of larger scale demonstration and understanding the impacts on a wider scale. So the more the greater the spread of different local authorities that you can kind of include in the project, certainly the better. Obviously, that does cause complexities in terms of how you delivered the project, but hopefully over the 12 months that will allow sufficient time to do that. And yes, we're looking for how things can be delivered across different demographics, different areas. So the more local authorities that can be involved to demonstrate that, the better from our perspective. Hopefully jump to the next one. Hi, Rob Parks from Genie Connect. Is it necessary to complete the application on the platform before finding a collaboration partner? No, you don't have to complete the application prior to finding a partner. What we kind of probably suggest that you do is find that collaborative partner and then work on that application together, I suppose, to make sure you've got the perspective of both included within that. So hopefully, if you haven't already got your collaborators involved, you can use the Simply Do platform to connect with those. I'd probably say make a start, the sooner you can make the start on the application form, the better. As Josh highlighted, is something you can dip in and out of. The system automatically saves it for you. So, the sooner you can kind of dip in there, start to understand what some of the questions are, probably the better for you, because then that hopefully drives your conversations with your collaborators as well. But find that collaborative partner and hopefully work on that application together before the deadline of the 20th. I'm not seeing. Oh, did you have another question? Nope, that's the same one. Here we are. Are you looking for applications that include an independent assessment partner? Potentially, yes. That would be useful in terms of, because we're looking at that kind of that benefits and that economic analysis. So that might not be something that a individual supplier has the experience to kind of deliver that type of analysis. So if you wanted to bring in an independent assessor that can help provide that benefits and economic analysis, then that certainly would be welcome as part of the application process. Just to say, if any of the other presenters want to jump in and get a word in edgeways, feel free to jump in at any point if there's anything you think that I've missed. Just see if there's any new posts. So Donna Coyle, can we have a copy of the full application in advance to read cues and guidance? So on the Simply Do platform, I'm afraid you do have to kind of log in to be able to access that. But once you're on there, you can download a copy of everything from there. If you have any problems, please just do drop us an email. Again, I'll repeat what our email address is. So that's sbri.coe@wales.nhs.uk. Please drop us an email if you have any issues on that front. But hopefully you should be able to access everything you need to on the Simply Do platform. John Griffiths, I've used Simply Do often, and being able to enter columns to explain costs is very difficult, as it tends to, got to make it bigger, tends to left justify, and you have to include spaces to make it legible. Can we have an uploaded spreadsheet, maybe a generic one for challenge for everyone to fill out? Would be very helpful. Appreciate that feedback. That's something that we can look at if that is something you're having problems with. Just one thing, and thank you for that, because you have prompted me to add something that I forgot to add earlier. So thank you for that. On the Simply Do platform, you'll notice at the bottom of the application that there's the opportunity to upload a PDF. So what we're looking for there is a letter of support. So in terms of that collaboration, whoever you're going to work with throughout the delivery of your project, we're looking for confirmation that they're committed as well. So the lead applicant will be submitting that application, but what we're going to be looking for is that evidence that whoever you've been discussing this idea with, they're fully committed to be part of this project delivery, so that basically if you're awarded the contract for R&D, you're in a really good position to start really quickly. So potentially, if you are having issues in uploading your costs, potentially you could add that as a PDF within that, but I'll talk to the Simply Do team, see if there's anything else that we need to adjust within that to look at that. As I said, if you do have any problems, just drop either the SBRI team an email or pop something in the little message chat box, the chat section that Josh highlighted on the Simply Do platform, and we can certainly look at that and see if there's anything we can do to help. Hope I don't miss any questions. Oh, hang on. What have we got next? Neil, will it be possible to see the contract template to view IP, etc., before diving in to complete everything? As I said, on the Simply Do platform, there's the example of the standard contract. If you look at when you're on the site, just at the bottom, scroll right down to the bottom of the screen, an example contract will be on there for you. So hopefully that'll cover everything you need. As I said, any questions, please just do drop us an email. Oh, Donna's asked a tricky question. Thank you, Donna. So you are asking for many components from a project to meet different policies and ways of working. If you had to prioritise 5 priorities, which one would they be? That's a cracking question, Donna. I'm wondering if I could kind of bring Stephanie and Denise, sorry to drop you both in there. I'm just wondering if you had any thoughts in terms of if you had to pick 5 priorities. And we're not setting anything in stone, you know, this is open to a myriad of different ideas. Are there, from your perspective, any kind of key 5 priorities that you would be looking for?
So I just wanted to check, Kate, because I slightly missed Donna's question. So 5 priorities in terms of what projects might look to
so in
address,
terms,
sort of thing.
Yes, basically. So
Yeah,
in terms
okay.
of different policies and ways of working, are there kind of 5 key areas that you would most welcome submissions being focused on? Hopefully I captured that correct.
Yeah, so I think, you know, probably in terms of kind of what I was saying before, I think our biggest challenges in dom care, which are therefore is the ones that we probably want to look to see, are workforce. But I think within workforce, we've got questions about increased retention. I think there are some issues around, there are issues around recruitment. I know we've had lots of pilot things on recruitment, but things around retention of the workforce. So that might be around, are there different terms and conditions? So if people were, for example, on salaried shifts rather than paid just for the hours of the visits that they undertake, would that make a difference to recruitment and retention? Are there other aspects of people's working lives that could be changed that would make it more likely for them to be in the sector? So anything else that within our gift, obviously around conditions of employment that would include that. I think that would be interesting. Are there things around how the work is organised and delivered, which is kind of a move on from, again, what I've said, that would make it any more attractive for retention and indeed perhaps more efficient with, you know, any kind of reduction of waste. I think also, so that might be both about kind of practicalities. Is there anything about scheduling of dom care systems, about IT systems? Is there anything about the delivery of outcome focused, which again butts up against the IT systems that are best able to deliver it, because some of those are sort of stuck in time and task. Is there anything about how the work is delivered in terms of how outcomes are assessed, but without duplicating work that's already been done? So I think that's it. That sounds like 5. I'm gonna say that's my best shot.
Brilliant, thank you, Denise, and so sorry for dropping you right in it.
No, that's okay. I was listening, honestly.
Can I just add one comment, because I think they all, you know, and it's almost a slant on what Denise has just said, but there's something about what could free up people's time so that they can spend more time doing that person-centred care and support, and we kind of know that that's the passion people come into this type of work with. So things that could free that up, but actually that this comes straight back to that co-design, the importance of that co-design in actually enabling that to happen. So it's just kind of a slant on what's already been said, but yeah, just wanted to make that point. Thank you.
Brilliant, thank you both. Hopefully that's answered your question, Donna. I'm going to move on to the next one, which is from Chris. Just to clarify on Rob's question, RE spread of LAs across Wales, would this be multiple LAs under one project proposal or submitting a separate proposal with each LA? Open to either, really. So I suppose in terms of assessing the scale of the potential solution that you're looking to deliver, if there were multiple LAs as part of that proposal, that would be a benefit and demonstrates how things are being delivered on a larger scale. As Denise pointed out earlier, we're looking to support larger scale projects rather than kind of small bits and pieces over Wales. But you can submit separate proposals. I suppose my only caveat with that is that obviously they'll each be assessed in their own individuality. So, you know, things that will be considered would be your capacity to support multiple projects, also the capacity of, say, the LAs that are involved in that as well. So please, you know, feel free to submit more than one application, but in doing that, try not to dilute the impact and the kind of robustness of the application. We'd probably like to see less applications, but of a greater quality than lots of applications that are kind of diluted and doing things in bits and pieces. So yes, you can. It's entirely up to you if you want to submit separate proposals, but the strength will potentially be in something that can demonstrate they've got multiple partners involved and they've got that kind of very robust application that we can see that their time's focused on that project rather than multiple little projects. So hopefully that makes sense. As I said, any questions afterwards, please do drop an email if you would like further clarification. Thank you, Rob. An actual perfect question, which is something I should have highlighted earlier. Wonderful, these Q&As. They remind me of all the things I've forgotten. So I'm assuming that Welsh language is a priority in terms of digital solutions. Are there any other programmes or partners that can help us with that? That's exactly the sort of thing that the marketplace is set up to do, really. If you're lacking support or kind of experience in the Welsh language side, please feel free to drop that in the marketplace. In the background, we're also having a peek at the marketplace and keeping an eye on it as well. So if people are struggling to engage, we'll do our best in the background to hopefully connect people that can help. But yes, extremely good point. Welsh language is going to be a priority. But also what we don't want to exclude is other languages as well. So coming back to that accessibility, Welsh language will be the priority, but if there's consideration for other language uses for, say, your technology solution, then that will be favourable as well, because what we're looking for is solutions that will meet large range of needs, you know, irrelevant of where they are in Wales or kind of what background they came from. So hopefully that helps. And if you do have any issues in connecting with people in those areas, drop us a line. I'm not promising we can provide that support, but we'll do our best to connect you with people who can. So William, has SBRI invited public and independent domiciliary care providers to the marketplace? Not directly as such. So in terms of how we've distributed this challenge, we're working with lots of different networks, including local authorities, to hopefully spread the word of this challenge and this opportunity as widely as possible. So basically, anybody can put their details within that marketplace and kind of say, this is who I am, this is my idea, this is where I work, I'm looking to connect with this, that, whatever, whether or not they're an individual care provider or whether or not they're, say, a digital technology provider. Anybody can go onto that marketplace and say, look, I'm interested in being part of this, I'm looking to work with this, that, and whatever. So we haven't, so it's targeted in a way because we've kind of done it through our networks rather than kind of any specific invitations individually, if that makes sense. And I think Steph wants to come back in there.
I just wanted to say we're trying to share it with our networks and through our communications, but I think we do come back to it not feeling that familiar to people. So as much as we can have conversations with people about it, we are. But if there's anyone on the call that can join in with that and sort of spread the word about this, that would be, you know, much appreciated, because I think, you know, having even attended today and having some understanding of what its potential is probably a lot more powerful than just seeing it written down somewhere. So yeah, that's what we're trying to do. Well, we are spreading it through bulletins and things, but we're also just trying to talk to people a little bit about it.
Fab. And that probably brings me on to a little bit of a reminder that there's a second briefing event being held next week. It's been badged as being targeted at third sector organisations, but anybody who kind of is unfamiliar with the SBRI process, unfamiliar with kind of applying to a funding route such as this, it's going to be a very informal session. At the moment, it's just going to be me kind of talking you through the process, some of the language that we use, some of the things, just providing a little bit of additional context and support for people who aren't as familiar with this process. So that might be an ideal opportunity, say, for independent providers to kind of jump on that call and just understand a little bit more about this process. And as I say, some of the things that we're looking for in the criteria and what that might mean to them and how this is relevant and applicable. So please feel free to direct people to that second briefing event as well. As I said, very informal. It's just going to be an opportunity for us to kind of chat through any concerns you might have, anything you don't understand, and we can just provide a little bit of extra support for those who aren't as familiar with applying for an SBRI. Just checking I haven't missed anybody out. So Sarah, you've mentioned that they should be stage 2 or 3 ideas. Please could you say a bit more about the level of readiness expected from an idea to be accepted? So we don't tend to kind of stick specifically to TRL levels in terms of technology readiness levels, but what we're looking for is that there's evidence that you've done some feasibility activities to date, and that this will enable you to move on to the next step. So we're not looking for really early ideas within the application. What we're going to be looking for is for you to kind of set out, what have you done to date? What have you learned? What are some of the challenges that you've uncovered? And how will this opportunity enable you to take that forwards and to build on that? So in terms of that prototyping and demonstrating, which I said for the stage phase 2, it's really looking at that on the ground testing. So we're not looking for desktop studies. We're looking to see that you're working with individuals, you're working with service providers, third sector, health, independent providers. You're working with them on the ground to understand how they work currently, how your solution or idea can help them, and how you're addressing the challenges that you come across during the delivery to make sure that whatever solution you're developing is really going to meet their needs and be able to address some of those earlier barriers that you might be coming across. And with that stage 3, phase 3 ideas, what we're looking for there, again, is for you to kind of outline within your application what work you've done to date, how have you prototyped it, demonstrated it on the ground, who have you done that with, what are some of the things that you've learned, and how will this enable you to scale and spread that. So what we're going to be looking for is, who are you working with that you haven't worked before? What kind of areas, demographics are you going to be working with that you haven't previously? So it's that sort of kind of, how are you going to kind of deliver this on a far larger scale with people you haven't worked with before to demonstrate this is actually going to be a solution that can work for more people and different areas across Wales. So hopefully that helps with that question. So stage 2, phase 2 as we call it, prototyping and demonstrating real on the ground delivery, and then the phase 3, moving past that earlier demonstrator and looking towards delivering something on a much broader scale with collaborators and different areas that you haven't worked with before. And as we said, looking through the application, you to kind of set out a little bit of context in terms of what you've done to date and how this will enable you to move forward from that. So hopefully that helps. Can we have the link for next week's meeting to share with our providers, please? Yeah, I'll get someone to drop that in the message, or I'll try and multitask and do it. My multitasking is not the best. If not, we can kind of send that around afterwards as well to everybody who's attended today, but I'll try and drop it in the chat as well. Thank you. And I think we've got another question here, if I can just scroll up a little, Michael. It seems like collaboration is key here, especially as one organisation probably can't do everything. Therefore, there doesn't seem like there's much time to find mutually compatible collaborators, let alone agreeing upon commercial terms with one another. That is a risk. unfortunately, as with everything, we are kind of confined in our timescales. If we want to enable these projects to be delivered over a longer period, we have had kind of condensed this first bit somewhat in order to be able to support that. So we do kind of recognise that that's difficult, but hopefully, you know, setting up the marketplace, you know, we're still open for, you know, just under another month. Hopefully you've been given enough notice to kind of work on that. Some of these details you might kind of have to kind of solidify once you know you're successful. But in terms of that letter of support, we're looking for that commitment that they are going to be involved, even if you haven't ironed out all of those details. So we do appreciate it's a big ask to get that all in place. But as I said, because this is looking, hopefully, what the aim of it is to do is to build upon earlier feasibility, to build on something that people have started to work on, started to kind of understand what the benefits are, and this enables them to move to the next step. So what we're hoping for is that there will be some relationships, some networks already in place that will be in a good position to take advantage of this opportunity. We're not looking for people to start from scratch as such. You know, we're looking for them to build upon good work that's already taken place, which is why, you know, another reason why the timescales are quite condensed on this, but we do appreciate that that's difficult. Andy, do you anticipate further rounds of this in future years? I don't know is the answer to this question. So this is, as we've said, you know, SBRI has delivered challenges within health before. This is probably one of the earlier ones, other than the GovTech ones that Steve mentioned earlier, that we've kind of looked at social care in this way. So it's kind of a see how this one goes. So hopefully it will be successful, and perhaps there will be other opportunities to do something similar in the future. But in terms of this particular challenge, there isn't any other funding kind of earmarked for this at the moment. So it will just be this one round that supports phase 2 or phase 3 projects. So it's not that they will move on to another round after this. This is the challenge, and this is the funding that's available. But that doesn't mean that we won't be running other challenges with social care in the future, but none as planned as yet. Our focus is on this one for now and to see how that one goes. But thank you, Andy. I'm not seeing any other questions at the moment, so hopefully I haven't missed any. Mike, I see you've done Josh mentioned that collaboration marketplace will be closed a week before submission. Can this be extended? I'll talk to Josh. Potentially we can do that. The reason for having the slightly earlier deadline is that we were a little bit concerned if they had the same deadline, people might mistake it for the actual application page, and we didn't want people to forget to actually properly submit their application. But we could potentially look to adjust that. I'll speak to Josh about that and see if that's something that we can do. As I said, there is the risk that people will think that they've submitted, but we will reiterate that, particularly through social media and things like that, just to make sure that people are getting the message that you have to submit on the actual main portal bit for your application. So excuse me, I'm just running through the Q&A sidebar just to make sure that I didn't miss anything. Whilst I'm there, I'll also try and drop the invite link for the next event, which is happening next week whilst I'm at it. So hopefully, please excuse me while I'm just doing that at the same time. But hopefully that'll give you a few more minutes to submit any other questions you have whilst you're waiting for me to work with the technology. As you can see, multitasking is not my strength, but hopefully I can drop this into the chat. I'll just pop it by there so you can all see it. So hopefully that all works for you. I've just posted at the top the link for the next briefing event. As I said, it's going to be very informal. It's just going to kind of be an opportunity to chat through things that might be just a little bit less familiar, and just some of the explanation around the terms and the wording and things like that. Josh, did I see your hand creep up just quickly there? Did you want to jump in at all?
Sorry, it was just a quick one to confirm where you'd popped that link, as I don't think people have access to the chat unless it's gone somewhere that I don't have access to.
Thank you for pointing that out. I popped it in the Q&A,
but
lovely. If that hasn't worked, what I'll do is I will try and find the person who commented earlier, and I'll try and put it in. There we are. I'll put it in here in response to someone's question as well, in the hopes that everybody can see that. But thank you, Josh. Hopefully everybody can see that now. So Neil, is it possible to describe our project offline to confirm it's eligible? Try and put my teeth back in, confirm it's eligible. Yeah, certainly. So not all members of the team are going to be involved in the assessment process. So we'll have people within the team that will be in a good position to have a bit of a chat, because they won't be part of the scoring process, so they can have that informal kind of discussion with you. So yeah, if that's something that you want to do, just drop an email to the SBRI email address, and hopefully we can set something up just to kind of have a bit quick talk through, just to see if it fits within the themes of the challenge. Obviously, we can't give you specific direction in terms of what you have to kind of put in, but we can give you hopefully a bit of a kind of sense check in terms of that. But as I said, there are members of the team that can help support that as well. So feel free to drop us an email. And Victoria, hopefully that answered your question at the same time. So speaking to someone offline in order to discuss the proposal, as I said, drop us an email and we'll see if there's someone within the team that can help support that, and have that bit of an informal chat with you. I'm just going back through just to see if there's any other questions. Oh, thank you. Did I put the wrong one in? As I said, technology is obviously not my strong point. I will try again to make sure. Yes, thank you. That was the wrong one. Please give me a moment. As I said, it gives you an opportunity to ask more questions whilst I fumble my way through the system. Just got the new one for you here. I will hopefully pop that back in. If not, if my computer skills fail me again, please keep an eye on our social media sites. So on Twitter, I know it's not called that, but Twitter and LinkedIn, because we'll be promoting it on there as well. It is not liking my, hang on. As I said, if you want a couple more minutes to drop a few more questions in whilst I try and find the right links. It will not be a moment. Let's try this again. There we are. Looks like we have the right one now. That's a good starting point. So hopefully you can all see that. I'll drop that back in. Hopefully you can, please let me know if you haven't been able to see that. I know it might take a couple of minutes to come through in the Q&As, but hopefully that should be the right link for you now. Oh, thank you, William. You put it in there as well to help me out. Very much appreciated. Thank you. So I believe that's all the questions answered, I'm hoping. If there is anything that I've missed, as I said, hopefully you've all got our email address as well. So if you do have any follow-up questions, just please do drop us an email. As I said, all the information will be on the Simply Do website, along with a recording from today's event. We'll pop it all up there for everybody to see. Again, take a look at the example contract in the additional info at the bottom of the Simply Do page, and feel free to kind of join the marketplace and hopefully connect with some other individuals that might be able to support you with your project delivery. Unless anybody else from the presenters has got anything to add, I think that just about takes us to close for today. Thank you so much for everybody's time who joined this call. Thank you again to the presenters and all the information you shared. Again, if I've missed any question, please get in touch afterwards. And if there's anything else you'd like to know, please just drop us a line by the SBRI email. But I think that takes us to a close today. So thanks again all for your interest. Hopefully many of you will want to submit to the challenge, and I look forward to seeing your applications. Anybody else in presenters want to say anything, or should every quick thumbs up? We all good? Excellent. Thanks again, everybody, for your time. I'm going to draw it all to a close. Thanks again. Bye-bye.